Welcome to Queer News Tonight's Q&A on LGBTQ plus health and pandemic. Since February of 2020, this segment has been unique in America, answering your LGBTQ plus community questions about our unique health needs. We are proud to have Queer News Tonight health anchor, Dr. Howard Grossman, joining us.
He's an American pioneer in HIV/AIDS medical treatment and was the executive director of the American Academy of HIV Medicine. He's a nationally recognized medical expert and proud member of our LGBTQ plus community.
Well, good evening, Dr. Grossman, coming from your new home in Chicago. Are you enjoying it? You're not cold yet.
No, I love it.
Yeah, well, good. It's going to be fun. Before we move into viewer questions, tell us a little bit about your thoughts of what you watched this week in health news for our LGBTQ plus community.
Well, I think we saw some good news on vaccines. The fact that the second dose of the Johnson & Johnson vaccine is now available for people; they should get it. We saw good news on pediatric vaccines in the last couple of days, which I think are going to be very important. I mean, lots of our community who have young children have been scared to death because those kids could not be vaccinated. I know lots of people who haven't traveled at all, haven't seen their grandparents, because of the fear for the younger children. So I think those are really good stories. Of course, I know one of the questions you have is a major story this week, so we'll talk about that. But you got some really serious stuff today that you talked about.
Yeah, absolutely. At Queer News Tonight, we have had a lot of heavy stories to explore today. Before we move into our questions, I wanted to ask you about the recommendations of the mix and match of the vaccines. What are your thoughts about what the FDA and the CDC are concluding in terms of being able to mix vaccines? All along I sort of thought that was going to be the way that they would go. I mean, certainly the Pfizer and the Moderna vaccine are very similar, work the same way. The Johnson & Johnson vaccine and some of the other vaccines that take a more traditional approach work differently. But I always thought that anything that's going to help you develop an immune response to the virus can only add to the process. Okay, great. All right, well, let's jump right into the questions that we have for you tonight.
Doctor, good evening. Thank you for joining us. Treatment delays due to COVID are causing ERs to fill up with people sicker than they normally would have been from non-COVID illnesses. Do you expect to see other issues like this over the holiday season in coming months?
Well, I think, you're dealing with a couple of different issues. Number one, a lot of people who have chronic illnesses were afraid to go to emergency rooms for a long time. So they've been putting off care. And so there's that group of people. And then, of course, you have the people who've refused vaccine who are coming down with COVID. And I think, I've seen some of the stories. I don't think it's totally clear whether this is more of a problem in places where more people are not vaccinated. As opposed to other places. Emergency rooms have always been a problem in big cities. And I had my appendix out back about 6 years ago in New York and spent the entire night in the emergency room because there were no beds and the surgical suites were all full. So that was way before COVID. And so emergency rooms have always been, had a problem. But, certainly what's going on now is very difficult, especially for smaller hospitals. But I think it's that combination of things that's happening there.
And next up, what do you think of the law enforcement officers who are walking off the job due to vaccine requirements?
And especially in your new hometown of Chicago.
Exactly. Well, one of the things I have to say is here in Chicago, as opposed to when I was in Florida, most people are taking COVID very seriously. So here in Chicago, you walk into a store, you walk into any place, everybody's got a mask on. There is no fighting. The signs are up in the front. It is the law here in Chicago. Not so true in southern Illinois, as with other places. And I know even close by, Wisconsin is a whole mix and match of places depending on where you are. Here in Chicago, less than 65% of police officers have been vaccinated. The head of the police union has been advocating actually people being insubordinate and disobeying orders from the department.
which is really interesting. I read, I saw John Oliver actually, where he said, these are the same policemen when they pull over a black person and they shoot him, said if he'd only followed orders, everything would have been fine. And so these are the people that are refusing to follow orders. These are people who are charged with protecting public safety, who will not protect public safety. They are going to be in the faces of elderly people, immunocompromised people, and yet they refuse to get the vaccine. And if you look back to the whole Black Lives Matter protest, the biggest problem in the police community are the unions and the union leaders who are backward and racist and homophobic and are keeping every attempt at police reform from actually happening. And I think this is just another example. And the head of the union in Chicago is a lunatic. And he has actually been banned by the courts from making any further public statements about this, although he's being defiant about it. And our own, well, not mine anymore, but your lovely governor death sentence has actually gone out there and said, and is offering a bounty for law enforcement officers from states where there's a mandate to come to Florida. So I'm really hoping, and I'm sorry about this, but I'm really hoping that all of the crazy people migrate down to Florida.
Really? It took you just 1 week to get off the Florida bandwagon. Really? Just 1 week. And you're wishing them all here.
Spoiler alert, doctor, they've already moved here.
Yeah, I was going to say. All right, our next question.
It's a sad comment when people who are charged with protecting people refuse to do so.
Doctor, 11 lions at the Denver Zoo have been infected by the Delta variant. Should we be worried about our pets?
Well, I'd kind of worry more about whoever it was that was French kissing the lions, whatever. Because the fact is that we're more at risk for pets than they are for us. So the few cases in the world where virus has been shown to be in pets or in animals have been transmitted from people. Animals tend to get a very mild case if they get COVID. There is actually a CDC webpage, which you can go find, which talks about all the recommendations for dealing with pets. It's very clear that the virus cannot be transmitted by the fur or the skin or of pets. So it's actually secretion. So if your pet is infected with COVID and he's kissing you, yeah, maybe that's a problem. But they have all kinds of recommendations there about how to protect if you have COVID-19 and you have a pet, and vice versa if your pet comes down with COVID-19, how to make sure to contact your vet, probably do telemedicine, but not show up at the vet. So I think, like I said, these 11 lions got infected probably by a zookeeper who wasn't vaccinated. And that's more of the problem. So they have big warning on that website page saying don't try to put toxic materials on your pets to try to clean them, because people have tried to do that. That's not a source of COVID.
And Howard, before we end our Q&A, new resident in Chicago, gay community. How's it going there? I mean, Chicago, IML and Market Days, an amazing Pride Center there. How are you getting used to being in Chicago, and how much do you miss Wilton Manors and all of us already?
Well, I miss you all personally. But I have to say that as I said, I'm really glad to be in a place that takes COVID seriously. I'm a big city boy, and it's nice to be back in the big city with all of the caveats about living in a big city. I love the cold.
Yeah.
Well, that's a good thing.
Howard, I have to tell you one thing. I did the red carpet with Faye Watt on Saturday at the National Task Force at Miami Beach Convention Center. And 700 people. And somebody from the National Task Force in Washington said to me they had watched this and they were unclear. They thought you were no longer going to be doing the Q&A, and they had watched. And they said that they loved in spring of 20 the Q&A segment because you were doing weekly grades for President Trump, and talked about, well, it went from D to D minus to F plus to F minus, and said specifically, I will never forget him going, can I give a grade any longer? And they said they missed you because you were no longer grading the President of the United States. So that's the impact that you've had during pandemic.
They're near and dear to my heart because they were the first big gay organization that I got involved with back in 1978 when they were a tiny organization, our only national organization, and I have fond memories.
Yeah, so I thought I'd share that story with you. Well, everyone, that is this evening's Queer News Tonight's Q&A on LGBTQ plus health and the pandemic. We're here every Tuesday with Dr. Howard Grossman. We'll talk about when pandemic's over, which is likely not going to be for another 12, 13 years. And we are always going to be here, and Dr. Grossman's going to be here to answer your questions. You need medical assistance? Again, we're happy to refer you, and we are very happy to have Dr. Howard Grossman from the Howard Brown Healthcare Center. First time that we've said that, because you're working live now in Chicago, the largest LGBTQ plus healthcare center in the Midwest. Thank you again for being with us, Howard.
Thanks, gentlemen.
Have a good night.
LGBTQ plus news is vital for our community and for the broader world as a whole. We have enough enemies at Fox News. Tucker, Sean, and Laura are loud. We need passionate allies. Happening Out Television Network, Queer News Tonight, and It's Happening Out are literally out of the closet and into the headlines. Our community needs your support. Like this broadcast and subscribe now to ensure the growth of the entire LGBTQ plus community.